Horses are beautiful, aren't they? Hi, my name is Niki Marie Hansen, and I am a veterinary prosthetist. That means I make prosthetic legs for all sorts of animals. Toby, Bob, and Padme are just a few examples. I have a certificate in prosthetics from Northwestern University's Prosthetics and Orthotics Center in Chicago, Illinois, and I'm currently working on my PhD in veterinary science at Louisiana State University. Veterinary prosthetics is a field that has been close to my heart since I was a child. My horse came up lame, and although he survived a risky surgery, I couldn't help but wonder, even as a child, why a horse couldn't have a prosthetic limb. Statistics from the racing industry state that 60 to 70% of horses euthanized are euthanized due to disease and trauma of the lower limb for which there is no satisfactory treatment. These cases include, among others, degenerative joint disease that don't respond to available treatment options, laminitis and trauma like lacerations, ruptured ligaments, and broken bones, and that's not counting all the other horses outside the racing industry. Amputation and the successful use of prosthetics are becoming more widely available in small companion animals, but this option remains largely elusive for the equine. The benefit of developing a treatment must always be weighed against the pain caused to research subjects, and as such, it will never and should not be acceptable to amputate the limb of a healthy horse in order to advance the availability of these treatment options. This until now has left the option of equine amputation and prosthetic development in a state of rare and often short-term successes. It is my belief that successful lower limb amputation and prosthetic implantation in the horse is possible. Horses are big, really big. So big, in fact, that if they aren't able to put weight on all four legs all of the time, their other legs will begin to get laminitis, a painful swelling of the hoof. Let's take a 1,000-pound horse, for example. This horse's weight is distributed with 60% of its weight carried in its front legs and 40% in its back. That leaves 30% for each front leg and 20% for each back leg. Now let's take a look at a typical human male that weighs approximately 200 pounds. That weight is distributed evenly, 50-50, over each leg. This average man carries 100 pounds on each leg. An average horse carries 300 pounds on each front leg and 200 pounds on each back leg. That's a lot more weight than a person. Now take a human amputee's prosthetic problems and amplify them 100 or 200 times. You get much greater problems. And that's what we get in the horse. Also, did you know that a horse doesn't have any muscles below what we perceive as their knees on their legs? They don't. The only soft tissue present are nerves, blood vessels, tendons, and ligaments. Without any muscle to distribute blood flow, the vascular supply to the lower limb is greatly diminished, like a person with diabetes that has difficult time healing from ulcers on their legs and feet. A horse often has a difficult time healing from any trauma of the lower leg. Horses are also not the best patients. When a horse throws a tantrum, they throw it in a big way, often hurting themselves again in the process. This is why the horse's temperament has to be assessed, so they don't mess up what we're trying to fix. Also, traditional prosthetics for horses are expensive, time-consuming. Most owners have neither the time nor the money available to properly care for an amputee horse. I'm not proposing to put a prosthetic limb onto a horse. I'm proposing to put one into a horse. Radical, maybe, but let's not jump to conclusions just yet. There's this cool guy in Sweden named Per Ingvar Brainmark, and in the 1950s he discovered a phenomenon called osseointegration, where bone grows into a material that has been implanted into the body. In this case, it's titanium. Osseo-integrated prosthetics have been used in people, dogs, sheep, and even a cat. The implants have made the lives of all of these individuals better by eliminating sores and swelling, but these implants also make the individual feel as if the prosthetic is more like a part of them. In the 1990s, a veterinarian in California cemented implants into the amputated limbs of horses. However, after about 9 to 12 months, the implants started getting infected, and with no way to treat the infection, the horses that had lived relatively comfortably with this implant had to be humanely euthanized. With some new work by a few researchers, the problem of infection with implanted prosthetics is close to being resolved. Although the veterinarian in California did something revolutionary, there is no hard data to back up what he did. There needs to be an incremental approach to show the veterinary community how long these implants will last and how strong they are. This is what I aim to do with this study. I'm going to use a titanium per-fits prosthetic implant designed by Dr. Noel Fitzpatrick of Fitzpatrick Referrals in England. Dr. Fitzpatrick's per-fits implant is special because it uses different surface roughnesses and coatings to help the bone grow into it or to ward off infection. The per-fits implant is distinctive because it encourages and allows skin to grow into it as well. Skin growing into an implant is extraordinary because a continuous skin implant interface doesn't allow bacteria to enter the body and cause infection. I will be testing to see how strong the implant is in the bone. I will implant the per-fits implant into the bone in a horse's front leg located below the knee and above the foot. No, I'm not using live horses. Over the past year, I have collected bones from horses that were humanely euthanized for a number of really sad reasons, like being so lame they could barely walk, having terrible neurological problems, or having really bad problems with their gastrointestinal systems that couldn't be surgically fixed. But even in death, these horses are still able to help save other horses by providing valuable research tissue, much like a human cadaver's role in a medical school's anatomy lab. The biomechanical testing of orthopedic implants outside of the body is standard in determining viability, durability, and longevity of the implant. Although these tests are not completely representative of the forces exerted upon the implants inside of the body, they do provide a very good estimate of how the implant will behave within a living animal. Things I look for when testing biomechanically are how a construct breaks, where it breaks, if it breaks, and how long it took to break, and at what force did it break at. I believe that implanted prosthetics for horses are mechanically sound and possible, and I will conduct strategic studies to test this hypothesis and to determine the feasibility of lower limb implanted prosthetics in horses as it relates to what I have determined to be problems inhibiting the advancement of this much-needed technology. I'm conducting this research to realize a dream of saving horses with new and innovative technology that will translate across a spectrum of research fields. This project will be the first in a series of studies that will bring the equine industry one step closer to a novel, new, and innovative technology that will save lives.
We will have cake and all the pretty little horses. Dun and bay, sorrow and gray, a paw with 6 white horses. Dun